Today we are discussing multiple sclerosis. In this video, we will define this disease and the signs and symptoms that accompany it, inform loved ones of changes, recommend adjustments, and prepare the affected for the emotional changes that will occur. Multiple sclerosis, or MS, is a debilitating disease that affects the central nervous system, or CNS. Within the CNS, multiple sclerosis attacks myelin, which then forms scar tissue. The buildup of scar tissue prevents the transmittance of nerve impulses traveling to and from the brain and spinal cord. There are 4 different courses this disease can travel. The first of the 4 is clinically isolated syndrome, or CIS. This course is a first episode of neurologic symptoms caused by inflammation in the CNS lasting at least 24 hours. The next possible course of MS, which is also the most common, is relapsing remitting MS. Following an attack on the myelin, there will be periods of partial or complete recovery. During recovery, symptoms may completely disappear, continue, or become permanent. Next, there is primary progressive MS. Primary progressive MS is the worsening of neurologic function from the onset of symptoms. Lastly, there is secondary progressive MS. The majority of people who are diagnosed with relapsing remitting MS will transition into this course and will further experience worsening of neurologic functions over time. Signs and symptoms include pain in the back or eyes, fatigue, gait difficulties, numbness and tingling, spasticity, weakness, vision problems, dizziness and vertigo, bladder problems, bowel problems, cognitive changes, and even sexual problems. Out of these, the 2 most prevalent symptoms are bowel and bladder problems, which affect 50% of the MS population, and fatigue, which affects 80%. All of these combined causes functional deficits in the diagnosed individual. Diagnosis is a complicated process. There is not a laboratory test or physical finding that determines if a person has MS. In order to diagnose accurately, an extensive medical history and neurological test will be run, as well as an MRI, evoked potentials test, and spinal fluid analysis. According to the National MS Society, there must be evidence of damage in at least 2 separate areas of the CNS to qualify for a diagnosis. There must also be evidence that the damage occurred at least 1 month apart and rule out all other possible diagnoses. Whether for the first MRI finding of MS and diagnosis, or for relapsing remitting episodes of the disease, medications are usually prescribed and can be taken by injection, intravenously, or orally. There are also complementary and alternative methods known as CAMs or CAMs. These include diet, exercise, stress management, or acupuncture. These should always be approved by your physician and used in conjunction with your prescribed medication. Therapy may also be used to treat MS. There are many branches of therapy that are utilized during this time depending on your symptoms. These can include physical, occupational, vocational, speech-language, and cognitive therapy. Patients with MS will have to make some adjustments at home to adapt to their diagnosis. Often, the person will lose sensation in their hands and have a hard time holding onto objects. Textured surfaces on items around the house or adaptive equipment such as buildups on utensils can make it easier for them to touch and feel. Supportive footwear may be worn to help increase balance and stability in patients who have MS due to the loss of sensation in the lower extremity. When feeling and sensation is lost, sensory precautions may need to be put into place. These patients are no longer able to distinguish between hot and cold and could injure themselves. Placing signs around the house can warn the individual of potential dangers and extreme temperatures. In some patients, they may eventually lose the ability to communicate. Voice-activated software would be beneficial for them and provide a way for them to communicate their needs with friends and family. Emotional changes such as grief and depression may occur with your loved one when diagnosed with MS. Being able to recognize the difference between the 2 can help determine if any additional medical attention is needed. Depression is more persistent and may last anywhere from 2 weeks to several months and is the most common symptom of MS. They may feel hopeless and no longer find interest or pleasure in doing things they used to enjoy. Treatment for depression will include psychotherapy and antidepressant medications. Grief, on the other hand, is a natural reaction to major changes that occur in life and usually resolves on its own. Seeking counseling and support can help while living with MS. Other emotional changes may include increased stress, anxiety, moodiness, and irritability. Cognitive functions will change due to the demyelination of nerve fibers and will affect about half the people with MS. These functions include memory for information retention, acquisition, and retrieval, attention and concentration in situations that needed divided attention, information processed by the five senses, planning and prioritizing executive functions, visuospatial function in visual perception as well as constructional ability, and verbal fluency, including word finding. Your loved one may experience loss in a few or several of these functions. Long-term memory, reading comprehension, as well as conversational skills are not expected to be lost. Although there is currently no cure for multiple sclerosis, there are several resources available to help alleviate the stress of the diagnosis. Ways to be involved can be found on the National MS Society website, or you can find different ways to be involved in your community through fundraising events or support groups. Being diagnosed with MS is a life-altering event, but there are several options to consider with your loved ones that can help.